What you see in this video?
Yes, in this video, I can see a child. This is basically maybe an infant, neonate, and he is in hospital setting. He is well alert, crying, and having cyanosis and cyanosis around the mouth. So this is central cyanosis. He's also having nasal cannula as well, which is displaced. Connected to the oxygen actually, and yeah, so
So,
by compounding all, my provisional diagnosis is the child is having cyanotic spells, most likely maybe due to breath holding spells or um,
okay. So I can see in this video a newborn or infant, we can say, age is not mentioned. The infant is on hospital setting and she's crying. And I notice that is, there is around the mouth that is cyanosed, blue lips cyanosed. And there is an oxygen also present, nasal oxygen. So it is a case of cyanotic spells. Never detected that it is a cough like that, cyanotic spells. So it
okay.
can be like, breath holding spell, there is no cyanosis present. Remember this.
Okay. Yeah, yeah.
So, and breath holding spell, they are not giving oxygen. It is a benign condition, oxygen not needed. It just a few moments, then child become normal. Okay, so it can be a case of congenital cyanotic heart disease, any cardiogenic shock, myocarditis. We know that myocarditis associated with pneumonia, pneumothorax, foreign body aspirations, infective endocarditis, even heart failure. That is we are keeping. Uh, what are the history you ask in this patient?
Yes, I would like to ask about the onset course and duration. Uh, is it for the first time, or previously it has happened, or no? And is it any associating factors? And is it having? I would like. Okay, yeah.
Okay. So the history would like to ask the onset course and duration, what increase and what decrease. So it's a neonatal infant. Of course, we ask the birth history. We keep in your mind what we can ask there. Birth history like prenatal history, preterm or not, type of delivery, any foul smelling like or need for resuscitation after birth with cyanosis, prenatal or postnatal diagnosis of any congenital heart disease. Then procedure done for him, any medication he is on. So any chronic condition he is taking any medications. None, that is a neonate. Or then maternal illness we can ask like during pregnancy, maternal any diabetes mellitus, suspicious of torch, positive maternal culture, maternal fever or raised inflammatory markers. Then any feeding difficulty, number of nappies change per day. Dehydration you are keeping in your mind. So what examination we do?
Yes, I would like to do general examination first. I would like to check for any clubbing, any peripheral cyanosis, and all the patency of the airway, breathing, and circulation. What about the perfusion? If he's having hyperperfused, checking all the vitals and the weight appropriate for age and height and length, and is there any scar marks related to the cardiac surgery, or he is having I would like to go for complete CVS examination, and
Okay.
yes, for any
So
murmur or any
examinations, it is then we keep in our mind what is the disease related. First, airway, breathing, circulation, and vitals. I tell you, especially the heart rate. It is a cardiology case. Oxygen saturations. The child there is nasal oxygen given. The saturation, hydration status, capillary refill time. Full cardiac examinations we are doing with full limb blood pressure and saturations. So cardiac examination, blood pressure and saturation. General examination for sign of heart failure. So this is all about. You are telling that sign of any clubbing. Clubbing, okay, but this is very newborn, so I think in this age clubbing develop or not. So clubbing including on the full cardiac examinations, it is inside the cardiac examinations, so it is right. So what are the investigation we do?
Yes, for investigation, I would like to go for the echo and ECG and full blood count. Yes, doctor.
Yes. So this is very easy. We are telling echo is diagnostic, ECG, chest x-ray, full blood count, ABG. So it is any cardiac cause in clinical, it is also coming. So echo, ECG, and chest X-ray we keep in our mind. So echo is diagnostic. We know that chest ECG we find right axis deviation, right ventricular hypertrophy. Chest X-ray we know that is cardinal feature, boot-shaped heart, and lung oligemia. Full blood count we are doing. Why? Because hematocrit is more than 60%. Then so give him advice to try to decrease the blood viscosity to avoid the cyanotic spell and thrombovascular accident, and ABG for metabolic acidosis. So this is the top. Then what management you give if this patient comes to you?
Yes, for this patient, I would like to keep the child in the knee chest position first, and then I would like to start because they are in so much pain. So I would like to start with the IV morphine, correct the signs of dehydration first, and then I would like to go for the IV morphine and.
Yes. So we know that cyanotic spells, that is positioning, that is squatting positions or knee chest position in small baby. Our baby is small. So from knee chest position we are giving because of cyanosis reduce. Then 100% oxygen we are giving. Oxygen decrease the irritability, anorexia, and decrease the pain. Hydration status with IV fluid. We maintain the hydrations for morphine for pain. Then vasodilator like beta blocker, sodium bicarbonate to correct the acidosis. Phenylephrine or non-adrenaline to increase the systemic resistance. Packed RBC, like if blood transfusion needed, we are giving. Intubation and emergency surgical intervention for BT shot. So mainly first positioning, that is nature's positioning. Then 100% oxygen we are giving, morphine we are giving, we are giving beta blocker, vasodilator. We are giving sodium bicarbonate
High
for
flow
acidosis.
oxygen. Yeah,
High
high
flow
flow
oxygen.
oxygen.
At the beginning, we are giving 100% high flow oxygen. When management ABC, keep it our mind. The airway I keep breathing, then circulation, hydration status I maintain, IV fluid I am giving. Then of course it is a serious cardiac causes I involve by multidisciplinary team and intubation emergency. And the cardiac multidisciplinary team we are involving first cardiologist, dietitians, and cardiosurgeon if indicated. Then if dentist lies with the school, support to the family, other team according to syndrome. So here lies with the school not needed. Our child is very baby, but support to the family, psychological support we give. So it is a cardiac case. What are the advice you give?
So, advice related to the dental hygiene, and tattooing and piercing, and exercise related advices, and nutrition regarding the advice to the child, and education to the family, and yes, and
Okay.
yes, doctor.
So this cardiac advice is universal. We need to keep in our mind any cardiac disease, any cardiac examination and clinical, also some syndromic disease associated with cardiac conditions. We will tell this, like good oral hygiene, restriction of the exercise if not indicated. So after talk with cardiologist, restriction needed or not. Avoid piercing and tattooing. Good nutrition, plus minus antibiotic prophylaxis against the infected endocarditis according to the guidelines. If cyanotic, avoid high altitude, take iron supplementation, prophylaxis against infective endocarditis, valve replacement, infecting endocarditis, use of anticoagulant. So, anticoagulant, restriction of exercise, plus minus antibiotic prophylaxis, these are with cardiologist advice. And cyanotic, then avoid the high altitude, take iron supplementations and prophylaxis. So, this is all about these video stations. Again, thanks for participation.